Hi, I'm your host, Amy Frena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery that they want or need when they want it and how they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. We are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers that can help you make informed decisions about your health, wellness, and personal care. We are talking about one of the most popular cosmetic procedures performed in the U.S., breast augmentation. Joining us is Dr. Niccole, a renowned double board certified plastic and otolaryngology surgeon. He is the founder and medical director of Cosmetic Care Plastic Surgery and Med Spa in Newport Beach, California. Selected by Consumers Research Council of America as one of the top plastic surgeons, Dr. Niccole is also very dedicated to giving back. For over 30 years, his Magic Mirror Foundation has provided no-cost cosmetic and reconstructive surgery to thousands of patients in need. Let's listen as Dr. Niccole talks candidly about breast augmentation and shares information that can help you determine if this procedure is right for you. Dr. Niccole, thank you for joining us. How are you today?
Fabulous. And yourself?
Good. It's great to see you.
Thank you. I hear you've got a little one coming.
Coming soon.
Congratulations.
Thank you. Very excited about it.
Good.
So before we get into the meat and potatoes and all the detailed questions we have for you, we kind of want to have some fun and get to know your personality a little bit. What do you say?
Great. I love it. Let's
All right.
do it.
Okay. So if you couldn't be a plastic surgeon, what would you be?
I'd probably either be a veterinarian or an architect because I love helping people, but I love animals too. My kids, my family, everybody loves animals in our house. My wife, from the time when we were married, we had horses to dogs to cats to. So I love animals, but I love architect. I love the beauty in buildings and bridges and especially houses. I think it's fabulous. So it'd either be an architect and a builder or a veterinarian.
Okay, wonderful. What would you say is the best piece of advice you've ever received, and who was it from?
The best advice I ever got was probably from old Pops, and it was focus, son, focus. Because I'm ADD, I get off onto these little tangents, and I get off into restaurants and nightclubs, and always something other than what I should have been doing, plastic surgery. So I think the best advice was his when he told me to focus on the medicine. You went to school for 15 to 20 years to become a plastic surgeon. That's what you should do, and focus in medicine. Maybe little different aspects of medicine, but medicine. So I learned my lesson. I made a few errors here and there, and now
that's normal.
I'm totally focused, and my son runs the office in the business aspect of it.
Wonderful.
And he said the same thing, Dad, as long as you focus, and don't get off on these investments. And I said, okay, you sound like my father.
Ways.
I said, no problem, I'll do it. And so that's where we are. He's been with me for 10 years now.
Wow.
And we've been growing our practice, which is great. I love it.
How is that working alongside your son?
He thinks he knows more than the old man, but I think I've got a lot of street smarts. So he's got a ways to go, but he's pretty smart. Pretty smart kid.
Wonderful.
I like to have him there.
I bet it's a blessing.
Yep.
So what about your favorite food?
Well, Italian. Well, I mean,
Come on.
I love Mexican food too, though, but my favorite is Italian. I mean, I was brought up on Italian food. My grandmother used to hang the spaghetti over the chairs. This was, people don't even know about that anymore. But, so I make all my own Italian food, meatballs to lasagna to everything.
Really?
I love to cook.
Which one's your favorite? I got to know before we move on.
My favorite meal is probably, I shouldn't say this because my daughter will kill me. She's a vegetarian, but ossobuco. But I do love lasagna. And I like all Italian food. It's the sauce that really matters. I mean, it's like any food. I mean, you can eat 5 different restaurants, the same meal, and one will just blow your mind. And it's the sauce and the spices. So
absolutely.
And it's really funny because I'll go to a restaurant and they think I'm nuts, but I said, could I have either a meatball, just a plain meatball and a sauce? And that'll determine whether I like that Italian style.
Really?
Yeah.
Ah. No, I like its insight.
Well,
It's good.
I owned a restaurant, so I had an
You do?
Italian restaurant.
Okay.
So I
And
got
the
all
sauce
those
was
recipes
perfect.
from my grandmama
Uh-huh.
and my mother. Yeah, I love cooking.
Really?
Yeah,
Another
I love
favorite
cooking.
pastime. Wonderful. So maybe other than cooking, what is your favorite thing to do on your day off?
My day off, I like to spend with friends and family
Mm-hmm.
and my grandchildren. And
Uh-huh.
yeah, I love to travel, but
Okay.
haven't done that recently because of
Yeah.
the,
Yep.
situation. So
Mm-hmm.
hopefully that opens up soon so we can start traveling more.
Absolutely.
I love the wine. I love wine.
Mm-hmm.
I love Napa is one of my
Yes.
favorite wineries. So I can't wait to get back up there,
Yep.
enjoy some nice red wine.
Good for you. You deserve it. What's one thing you could not live without?
One thing I could not live without is my friends and family.
Yeah.
A very small group. My dad once told me, son, and I used to tell, oh, Dad, I have so many friends. You should see in school. I was on football, wrestling. And I grew up in Huntington Beach, but I had tons of friends. And my dad once came up to me and he said, son, you know how many friends you're going to have? By the time you're about 30 or 35, you're going to be able to count all your friends on one hand.
Interesting.
And so right he was. I mean, if you need a kidney or if you need something that's really crucial in your life, it's going to be probably your one, maybe two of your closest friends or family members. So even though I do have hundreds of friends and patients that I love, but when it comes down to the bottom line, the real, true people that are going to give you anything you need would be probably family.
Absolutely.
And then a few good friends.
Absolutely.
And I
Dad
cherish
was a
that.
wise man. He gave you a lot of good advice.
Yep.
All right, so can you tell us a little bit about your journey to plastic surgery and some of your credentials?
Okay. Grew up I was 5 years old when I came from Boston and lived at Huntington Beach all my life. I went to Huntington High, then I went to military school. I went to Pepperdine University, graduated from UCI Medical School. I wanted to be a general surgeon, so I went 2 years to general surgery, and it was kind of boring. So I then decided I think I want to do ear, nose, and throat because I'd like to do rhinoplasties and ears and facelifts and stuff. And I loved it so much that I told my dad, he almost killed me. Dad, I want to go 2 more years for plastic surgery. He said, you're going to be a professional student. You're an old man. You need to get out there and make some money. But I just love learning.
Yeah.
And so I went 2 more years. And so now I'm board certified in ear, nose, and throat and plastic surgery. And I'm the medical director of Cosmetic Care, which is a Newport Beach facility. And I've been there over 30 years. So it's
wonderful.
It's been a great practice. Wonderful. And I did my humanitarian type things. I've been all over South America, Central America, Mexico, and allocated a lot of my time to cleft lip and palate and burn patients. I did years of that, and it was really rewarding. But now that I'm getting older, we still have a foundation called the Magic Mirror Foundation. And I allocate free surgery for bullied kids, women and children of domestic violence that are been beat up, or and probably 2 of the most common were the bullied kids with whatever facial deformities they have, and I'd say domestic violence. Right. But we've done breast reconstructions and a lot of different things. But it's called the Magic Mirror Foundation, and I'm kind of proud of doing that because I got too old to be traveling, a week at a time through all Central America and South America and Mexico. So I'll leave that up to the younger guys now.
There you go. Well, it sounds very rewarding.
Yeah, it was.
I bet.
Yeah.
All right. Well, we are going to get into some questions on breast augmentation, and let's just start right off the top. What is breast augmentation surgery?
Okay, breast augmentation there's many aspects of breast augmentation. If you have an asymmetry, you can do breast augmentation to make that patient more symmetrical. Mommy makeovers, where patients have breastfed their children and they're starting to droop down and they need a lift plus enhancement because they're deflated. So it's putting a device, whether it's silicone or whether it's fat, taking stem cells and body fat from an individual and putting it back into their breast, or putting a device inside of the breast underneath the muscle. So it's a form of enhancing the breast or making the breast look more attractive and beautiful.
Okay. You kind of touched on this, but what makes someone a good candidate?
What makes a good candidate is probably somebody that's realistic. If the patient's expectation far exceeds the doctor's capability, then you probably shouldn't do that patient. But almost anybody that has, for instance, no breast, and she's a female, and a lot of clothings and bras, and when you're in high school and everybody in the class and PE have somewhat of decent breast size and you don't have that, if it bothers you, and it's not for everybody, you have to understand that. It's for somebody that looks in the mirror and says, I think that would help my self-esteem. Not, I know if I get breasts, I'm going to have 3 more boyfriends and I'm going to be president of the class. That's the wrong patient to do, because it won't do those kind of things.
Right.
Reasonable, smart, intelligent people that are, that know that it's only going to help their self-image. It's not going to change the world in any way.
Right.
And so,
good advice. What should a patient look for in a plastic surgeon?
I think when you're shopping for a good plastic, it's like anything. If you want an architect, you're going to go to the house that looks like a square box, or you're going to go to that architect that just has the design that you just absolutely love.
Right.
So when you're doing your homework with a plastic surgeon, you have to make sure they're board certified in plastic surgery. Not an ENT, not a dermatologist. They are good surgeons, but I think it behooves you to go to the guy or girl that has done most of the training, 10 years of training to become a plastic surgeon. Make sure he's board certified. Make sure you look at reviews. Just because he's board certified doesn't mean he's a great surgeon.
Right.
If he has bad reviews, think twice.
Right.
Go see his office. If he's got a, dirty floor, old torn couch, well, maybe your breasts are going to look like that. So you want somebody that's proud of their work and has photos, has a good website, and has a good personality. He's going to be there if you have complications. Usually referrals are really good, but not only referrals. Just because somebody refers to you, you still want to make sure he's qualified.
Right.
So qualifications, good demeanor. He's sociable. His office is organized. You walk into that office, they're ready for you. They know your name. Everything's clean. Those are things that are crucial, in my opinion.
Right. Okay, wait. Explain to me this whole board certification thing.
Board certification is extremely complex.
Okay.
And there are a lot of physicians that don't understand it. So don't feel like, as a layperson, you feel stupid. No, it's a complex situation. I'm board certified in plastic surgery by the American Society of Plastic Surgeons.
Okay.
A dermatologist can be board certified by the dermatology world. ENT by the ENT world. So there's many specialties. Now, would you want to go and have your heart done by a dermatologist? No. Would you want it by an ENT guy? No. Would you want major body reconstruction or cosmetic surgery done by a board certified plastic surgeon, board certified by the American Society of Plastic Surgeons? Or would you want it by an emergency room doctor, board certified? No, don't forget, these guys are all board certified, but not in cosmetic surgery. Okay. Now, there's one tricky board that, and I don't know what their training goes through, but the cosmetic boards, now they are not associated with us by the American Society. So all I can say is, I don't want to get messed up with restraint of trade or anything. All I can say is do your homework. I personally would prefer somebody to go to a board certified surgeon in the specialty that they're looking at. If you're looking at cosmetic surgery, the American Society of Plastic Surgeons. If you're looking for Cardiac Association.
Okay.
So do your homework and ask your surgeon when you go there, tell me the difference between your board and the guy that I went to see down the street who's emergency room board certified. Well, it seems simple to me, but it isn't, because I've been doing this for years, and it is confusing and complicated. You'll see big ads on the front page, cosmetic surgeon, doing breast surgery, et cetera, et cetera. Board certified in what? He's board certified. So that's kind of trickery, that I'm board certified. Well, the question always becomes, what are you board certified in?
Okay, very
So
important
make sure you ask that question.
Okay. Are there specific questions that patients should ask the doctor during the consultation?
I think they should ask a lot of questions because, you see these, $4,000 breasts, $8,000 breasts. Well, what's the reason?
Right.
I would want to know, how many breasts have you done, Dr. Niccole, or whatever doctor you're going to?
Yep.
Do you do, one a week? Do you do one a month? Well, if you're going to go have your heart operated on, don't you want a surgeon that operates on hearts every day?
Yes.
That's our questions. How many have you done? But that not only how many have you done, are you putting saline in there? Are you putting silicone in there? Saline's a much cheaper implant.
Right.
That's why one surgeon may be getting 6,000 and one may be getting 10,000. But part of that is the experience of the surgeon too.
Okay.
I've been around 35 years, probably over 25,000 breasts. So it's like, if the old cliche again on the architect, do you want the architect that's only built 3 houses, or do you want one that's built a lot, or the bridge, the safety of the bridge? So it's no different than any industry. Get the guy that has the most experience and is board certified and can show you beautiful pictures. Let me show you, this is my breast.
Right.
We have an imaging system that shows you. We take a photograph of you and show you what the enhancement can do. So oftentimes doctors will show you a lot of other patients, and that's good to get you into the office so you know what kind of work he does. But then what kind of work can you do for me? If one breast is down here and one's up here, well, can you fix that breast and make the other one look like mine? Or I'm flat as a board, can I get a little bit of cleavage? So I think it's really important as a consumer to ask questions.
Right.
Do you, what do you have to offer me? Do I have to come up with all the cash? There are so many questions that, and if you've got a good office, my staff people, for instance, they've been with me for years, so they know all the pertinent questions to ask the patient, or, enabling them to see and make a good decision.
Right.
Plus, we have 4 other board certified plastic surgeons, so you don't want to see me. I'm the old man, so I'm a little more expensive. But you can go to one of the other surgeons who are great. They're board certified.
Okay.
Probably save a little money.
So I want to touch on something that you mentioned, because I know I'm a numbers person. So you said how many they're doing a week, let's say, or a month. How many surgeries, breast augmentations? What can you just give us like a general number, a month or week, just for the person out there that's really curious? Like, what is normal?
Well, I think if I would
experienced.
About me personally, that's one of the most, I do noses and breasts are the things that I focused on at this point in my life.
Okay.
When I started, I did, I still do a lot of tummy tucks, but mommy makeovers, but I don't do those big body lifts. I have a partner that loves to do them, so I give them, those are 6-hour cases.
Oh, wow.
So, you want to go to a surgeon that his passion is whatever you're looking for.
Okay.
That's the key. Does he
sense.
really want and love to do that?
Okay.
You have to watch them. So, you come in for a nose and you say, oh, yeah, do you ever think about your breast, or you want some lipo? God, that's a sales pitch. You don't want to know that now.
Okay.
So you have to focus on what they want.
Okay.
Don't, make their image of themselves go down the toilet because you're, commenting all kinds of things that you can do for them.
Okay.
So focus on what they're asking for. Make sure that surgeon's professional.
Okay.
And I think, and board certified again, I think you want to make sure that's the case.
Okay. So you touched on this as well, but how much does breast augmentation typically cost?
If you go to probably a decent plastic surgeon that does at least 3 a week.
Okay.
I think at least 2 or 3 a week would be mandatory, and at least for probably 4 or 5 years, you'd probably run anywhere from 8 to 15,000.
Okay.
And a lot of that is, I have an excellent surgeon from Alabama. He charges $6,000. Well, the implants are almost $2,000. So
Gotcha.
You're not going to get that so much here. You go to Beverly Hills, you're going to spend $15,000, sometimes even more. Orange County, you're probably going to spend anywhere from 8 to 10 on a good surgeon.
Okay.
And a good quality implant.
Right. What payment options are available for someone who decides they want this procedure but maybe doesn't have all the money up front?
And that's quite common. I mean, my practice would probably be cut and a quarter would be cut off.
Wow.
So I think, one of the best that I've been using for years and years is CareCredit. They're phenomenal. And I mean, it doesn't take a rocket scientist. All you have to do is get your phone, download the app, and it's pretty self-explanatory.
Awesome.
My employees can help them, but they have to do it on their own.
Gotcha.
So they can accomplish that with ease. The software is impeccable. I mean, it's so easy. I'm not a computer guy, but I can do it. So if I can do it, they can do it. And they'll love it because it helps them out. So yeah, it's been a godsend for us. It's been helpful.
Great to hear. So what types of breast implants are available, and what determines which type is appropriate per patient?
And that's a good question because the surgeon should be able to know that, and each individual patient's going to be different.
Okay.
If you've got a very, very muscular patient that has a large pectoralis major, a muscle, the thickness, you might want to put a high-profile implant because you won't get much projection if you don't.
Got it.
If you have a lift, when you have a lift, you tighten all that skin. It has a tendency to lessen your projection, so you might want a higher projected implant. Where just the normal average patient that doesn't have any droopiness, doesn't have any problems with their breast, just small, then a moderate plus. So there's moderate pluses, low profile, moderate plus, high profile. As the projection increases, the base decreases. So, and that may be complex for an individual. If a surgeon's well-trained, he should be able to tell that patient and give him fabulous advice on what he recommends.
Okay.
But I like silicone because saline feels like a water balloon. People think, saline is safer, and all the bags are made of silicone. Okay. So whether you put saline in them or whether you put silicone in them, your body reads the outside of that bag, and it's silicone.
Okay.
Now, the newer silicone is really nice. I mean, it's a great implant. My daughters have 2 of these newer style implants in them, and they're kind of a cohesive gel, it's called. It's like a gummy bear.
Okay.
So when they break, they're not going to migrate all over your body.
Gotcha.
This morning I had surgery, and I had an older style implant that ruptured, and it's like gooey. I mean, it comes out like molasses. So that's nice. We don't have that anymore. So
Good.
That's the advantage of technology. I mean, it keeps improving and improving. But if it was, my daughters could have anything they want. They got silicone implants. So I love silicone and the durability especially. I mean, 20, 30 years.
That was my next question. Okay. Excellent. Let's talk about risks and complications associated with the surgery.
Risk, death from anesthesia. I've been doing it 37 years now. I've never had a death. So if you have a good team, you have a good anesthesiologist, it's pretty low. Make sure your patients, and a good surgeon's going to ask the patient, do you have any medical problems? Do you have any heart problems? Do you have any lung problems and diabetes, things like that? You want to get a good history because there are a lot of young patients that have probably not made it through surgery because the surgeon didn't get a good history. So make sure you have a good anesthesiologist. Okay. A lot of complications are related to anesthesia. I mean, that's terrible, but it happens. Right. So go to a good, reputable plastic surgeon for any kind of surgery, and you won't have the problems with death. Now, there's infection. I put my patients on antibiotics before surgery, during surgery, after surgery. I soak their implants in antibiotics. So we cut that probability of an infection. I may see an infection once every 2 years.
Wow.
So it can happen, and then your incisions, you can go around the nipple, you can go through the armpit. Well, the nipples, for instance, when you breastfeed, you have ducts that go to the mammary tissue.
Right.
All those little pathways, those little ducts are full of bacteria. Why do your armpits smell? Bacteria. So I don't go through those routes anymore. The American Society of Plastic Surgeons recommends going underneath. Now, I'll tell the patient, I'll give them their option. Your risks are higher going through the nipple and going through the armpit for infection and what's called encapsulation. Your body reacts to the implant and you get hard scar tissue, and your breast feels like hard orange instead of a nice soft breast.
Got it.
And the nice thing about implants today, the manufacturers give a nice warranty, and I tell the patients, buy the insurance because the warranty is great. If you have an encapsulation, they will pay for a significant amount for the first year.
Okay, good to know.
And if you have a rupture. So getting insurance is really, I think, beneficial because you never know what could happen.
You never know.
Although all these things are rare, they're possible.
Better to be safe than sorry.
Oh, absolutely. You're right.
So when a patient decides, okay, I'm going to have breast augmentation surgery, what should a patient do at home to prepare?
Well, at home, I think today, the difference between today and 20 years ago that they came in the office, I had to spend an hour with them. Mm-hmm. Today, I have consultants who are trained to do and talk to patients, so that helps. I think if you go to a good group, whoever that is in your city, and it doesn't matter where you are in the country, go to a good group. Most of that is going to be explained to you in thoroughness with a list of things you should do and shouldn't do, especially medications. There are so many medications you shouldn't be on, and there are medications you should be on. Okay. So you're going to follow that protocol. But psychologically, when you're home, you have to tell yourself you're going to have a little bit of pain. Okay. But you have to realize that most of my patients and most of any other doctor's patients, they have surgery on a Friday. If they have a desk type business, they'll be back to work on Monday or Tuesday.
Okay.
I think for the first 24 hours, it's crucial that somebody watches you and takes care of you.
Okay.
Because you've just undergone, general anesthesia. So somebody should be watching you that first 24 hours or 12 hours. But after that, you're pretty much on your own. You can go to the restroom. You can make a meal. You might want to order a week's worth of food at the house just in case you're one of those little wimpier type of patients. But a lot of my patients go out within 2 to 3 days. They call me, can I go out to dinner? I feel good. Sure. Can I go to my son's soccer game? It's been 2 days. Yeah, but have your kids or your husband carry the chairs. I mean, sure you can. So different strokes for different folks, but the majority would be surprised how quick you can get back into society. But I'm going to restrict you. You can't go to the gym. You can't go jogging. You can't go bicycling because those little blood vessels that I cut across can open up and bleed and then back to surgery again. And you don't want to do that. No. And I tell you, that is so rare in my practice, but it's because it's instilled in the patient what you can do, can't do. But have maybe 3 to 4 days worth of food that just in case you don't feel like going out.
And you don't want to carry those grocery bags, that's for sure.
Absolutely not.
Okay, so tell us how the procedure is performed from start to finish.
Okay, the patients will come to our office. First of all, I see them. I decide what they need. They'll get a price. They'll pay for it. 2 weeks before surgery, they'll start getting off aspirin, Motrin, anything that causes them to bleed, vitamins. I mean, those are healthy, but not healthy during surgery because they thin out the blood. Right. So that's a protocol we already have, and the nurses tell the patients that. Then they sign all their consents, sign their life away to me. Right. And then the day of surgery, they'll come. We usually start at 6 o'clock in the morning, so they get there about 5:30. Okay. The nurses will wipe them all down, wash them down, and I'll walk in. And I never put a patient to sleep until I talk to them. Okay. And the stupidest question, they think I'm crazy sometimes, but I warn them all the time. What do you haven't done today? What do you mean, what am I having done today? You should know what I'm having. Well, yep. I do know, but do you know what I'm doing? Right. So we talk about what we're going to do again, even though we saw each other in the preoperative period. But and then they tell me, and then the anesthesiologist comes to them, and they start an IV, give them a little sedation, bring them in the room, put them to sleep. I like most of my patients to sleep because I can tell you that I don't like pain. And I don't think most people like pain. So the safety of anesthesia today is impeccable. I mean, it is so safe. Like I said, that was just breast 15 or so thousand. I mean, I've done noses and lipos. I mean, I don't know how many hundreds of thousands probably. Never had a death. I mean, my surgery center. So I think if you go to a good surgeon, he knows his patient, knows you're in good health. Anybody over 50, I think 55 or 50 will get a cardiac clearance. you want somebody to make sure it's elective surgery.
Right.
You want to come out of that looking good and feeling good, not, brain dead.
Right.
So, and again, it's pretty rare if you go to a good surgeon. Okay. Apparently they had a major complication recently in Orange County, which is sad, but I don't know the details, but wow, what a bummer. Come in for an elective procedure and not make it. So make sure your surgeons are qualified. That's the whole key. And he has a great team, and I think you should do great.
Okay. So once I'm asleep and I'm on the operating table, what happens after that?
I go have coffee and donuts, and then I come
play your favorite song.
So you're asleep on the table, then there's a nurse. There's always about 3 or 4 people in a room all the time. Anesthesiologist, the doctor, the nurse circulator, a scrub tech. So the circulating nurse will prepare and prep the patient with antibiotics and scrub, and I require them to scrub the hell out of them because I know what bacteria is the thing that's going to screw your surgery up.
Right.
So I give them 2 grams of an antibiotic. I give them a good high dose intravenous antibiotics.
Okay.
We scrub them down. We have antibiotics in the back table where we put the implants in to soak in antibiotics.
Okay.
So we take all the precautionary measures and then we start the surgery. Little incision here, but that long, and then we make our incision. We go underneath the muscle on most cases because when you do mammograms, you want to be able to do mammography with precision. And 1 in 7 women are going to develop breast cancer. So you want to be able to continue that process of mammograms after the age of 30, 40. Then clean the pocket, irrigate the pocket, put numbing medicine in the pocket, put the implant in, sew them up, put steri-strip, no stitches on the outside.
Okay.
Just steri-strip, so they don't have to have any steri-strip. On rare occasion, do you have to put a drain because there's too much bleeding. They didn't listen to you and they took their aspirin or they took their vitamins and they bleed too much, so I'll put a drain in.
Got it.
Because an accumulation of blood will also cause problems with encapsulation, which is the hardening of the breast.
Okay. So what can the patient expect to experience during recovery?
The recovery, and it's like anything in life, there are some patients that have their babies and want to go home that afternoon or the next morning. There are some that want to stay in bed for a week.
Right.
And it's the same with surgery of the breast. I mean, it's pain threshold related. Some patients are tough. They want to go to the gym in 2 weeks. And no, you're not going to the gym in 2 weeks. You go walk down from Newport Beach to Laguna if you want. Walk.
Right.
But nothing because I cut across a lot of little blood vessels. Those little blood vessels can open up.
Right.
If you elevate anything from, if I get a call at 11 at night, most often it's sex. So no sex, no treadmill, no exercise, no gym for about 3 to 4 weeks.
Okay, you heard it.
You heard it. So, and then I'll allow my patients to drive within 2 to 3 days post-operatively, as long as they're off medication, no pain medicine.
Got it.
Yeah.
What can a patient do if, for whatever reason, they're unhappy with the results of their surgery?
And again, my staff are real. In the old days, anybody that walked in the door, come on in, let's do your surgery. Okay, bam. And I look back and I say, why the hell did I ever do that patient? Because it's a nightmare, my nightmare patient. And my staff is pretty good at that, picking out patients that have an unrealistic expectation.
Right.
So you want everybody to be happy. You want to be happy. Your staff wants to be happy. You want them to be happy. So what can I say? I mean, you want to make sure the patient is stable. Like I said, you want them to do this because of self-image. I want to improve my self-image. Not I want to be the president of my class. I need 5 more boyfriends. Right. It's not gonna happen. So realistic expectations are crucial, and then make sure they follow directions.
Right.
The directions are crucial, and my nurses are great at that. We have a list, and we tell them what they can do, can't do. I see them the next day and a week later, so I follow them closely to make sure they're following the directions.
Okay. What results can the patient expect as time goes on?
Well, I would say totally. Some doctors say a year, but 6 months. If they don't have what they have, and we're human.
Right.
You know, do you have a little asymmetry? And that's why I like to see them early, because I can put what's called a Velcro band. It's like a rubber band, but it's wide, and I can adjust breasts a little. If one's a little higher than the other, I can bring it up a little or adjust those. Probably 95% of those can be adjusted with a band. On a rare occasion, you're going to have to go back to surgery.
Okay.
And that's one of the reasons I encourage patients to get insurance and stuff, because it's no different than a valve.
Right.
If you have a heart valve and all of a sudden one of the best surgeons in the world put it in, if you have a little leak, you may have to go back to surgery. So it's always good to have some security there with insurance, and we encourage all our patients to get that, so there isn't a burden on a financial basis.
Right.
So I think that's important too.
Okay. Well, you've given us some wonderful insight. Thank you so much for your time.
You're very welcome.
We learned a lot about breast augmentation from one of the country's leading board-certified plastic surgeons. If you're considering breast augmentation surgery, we hope we've provided information that can help you to decide if you want to take the next step and schedule a consultation. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store, a thumbs up, and share with a friend. I'm Amy Freina with CareCredit, and I'll see you soon.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. Purchases with the CareCredit credit card are subject to credit approval. Minimum monthly payments required. See carecredit.com for details. This content is subject to change without notice and offered for informational use only. You are urged to consult with your individual medical providers with respect to the information presented. Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, makes no representations or warranties regarding this content and accepts no liability for any loss or harm arising from the use of the information provided. Your participation in this presentation constitutes your acceptance of these terms and conditions.